Hi everyone, welcome back. Today's video is the third and final video about the cytoskeleton. In this one, we're going to learn about the final filament type, which are the microtubules. Let's get started. All right, so now let's start with an overview of the cytoskeleton. So in medicine, whenever we say cyte, we're referring to the cell. So leukocyte means white blood cell. Cytosol is referring to the solution in the cell. So of course, cytoskeleton means the cell skeleton. So now the next question is, what does the cell skeleton actually do? And it kind of does the same thing that our body skeleton does for us. It provides structure, stability, and movement for the cell. Now, when we think about our skeleton, we're talking about muscles and bones and cartilage, but the cell skeleton is actually much simpler. It's just basically a network of filaments, which are just protein fibers. And the way it works is that these protein fibers are made up of building blocks that are assembled and put together into long chains, and they essentially form these beams or skeleton that helps provide the structure, support, and movement for the cell. So now the only other important thing to know about the cytoskeleton is that there's actually three types of these filaments. So the smallest filaments are the microfilaments, the intermediate filaments are the medium-sized. So the only thing that's left over are the largest size, which are the microtubules, and that makes sense because these large filaments actually formed these tubule structures. So for each of these three filament types, there's two things we need to learn. Number one, what's their structure? What are they composed of? And number two, what's their function? What do they do in the cell? And so for the rest of this video, we're going to learn these things about the microtubules. All right, so let's start with the structure of the microtubules. Of course, they have the largest diameter as we talked about, and their building block or the monomer is a protein known as tubulin. Easy to remember because these are microtubules, so tubulin for microtubules. And there's two types of tubulin, alpha and beta, and these come together and form dimers. And when they're bound by GTP, they're actually going to polymerize into these long polymers and eventually form a cylinder or tubule-like structure. So it's going to look like this. So you have these alpha and beta dimers that are going to polymerize and form these long polymers and eventually this tubular structure, and this is what a microtubule is. Now, important that these guys are dynamic. That means they have to constantly get larger or longer and shorter in order to meet the needs of the cell at that time. So they can also go the reverse, so they can depolymerize when they undergo GTP hydrolysis and get shorter. One of the most important functions of microtubules that you're going to learn about shortly is movement and motility around the cell. Therefore, they actually have two motor proteins that are associated with them. These are dynein and kinesin, and each of these do different functions, and we're going to get into that shortly. So now let's talk about the functions of microtubules, and they're responsible for three very important functions inside of the cell. So number one, in mitosis, microtubules form the centriole and the mitotic spindle. Number two, they're important for transport of intracellular vesicles and cargo. And number three, microtubules help form specialized appendages, which are flagella and cilia. So for the rest of this video, we're going to talk about each of these functions. So let's start with function number one, which is microtubules' role in mitosis. So it's important that the role here is in early mitosis, which is phase one. So here our cell is getting ready to divvy up its DNA. As you can see, everything is all lined up in the middle. So the microtubules are important here because they help form these centrioles and the mitotic spindle. And this is going to allow for the separation of these sister chromatids into the two separate corners. And then after this happens, then the cell can progress to the rest of mitosis and then complete cell division. And this is a very important role of mitosis. I want you to call your attention to the fact that this is different than the role of microfilaments, which are the actin filaments. These guys also function in mitosis, but their role is in late mitosis, which is cytokinesis, or the separation of the daughter cells. This is different than the microtubules, whose role is in early mitosis, phase one, formation of the spindle. So make sure you don't get that confused. Now, there's a very important clinical correlate here with the role of microtubules in mitosis. So some of the most commonly used chemo drugs, for example, Taxol and vincristine, their mechanism of action is that they disrupt microtubule assembly and disassembly. And by doing this, they're going to impair the formation of this spindle and centrioles, and essentially they're going to disrupt this early mitosis. So they're going to halt mitosis and cell division right in its tracks. And this is, of course, going to slow down the cancer cells because one of the hallmarks of cancer cells is that they're rapidly proliferating and spreading. So this is going to prevent the spread and division of cancer cells, and that's why these drugs are very useful in chemotherapy agents. All right, so now let's move on to function two, which is microtubules' role in vesicle transport inside of the cell. And these vesicles are carrying important cell content that needs to go from one part of the cell to somewhere else. And so the cell has these motor proteins that can transport this cargo, kind of like a train using the microtubules as their train tracks. Now, this movement is directional, and as a standard designation, the part that's near the nucleus is the negative end, and that's easy to remember because both negative and nucleus begin with the letter N. And then the opposite end of the cell, which is the periphery, this is called the positive end. Again, easy to remember because both positive and periphery begin with the letter P. So why do we care about all of that? It's because our two motor proteins each only go in one direction. So when the vesicles are moving from the negative or the minus to the plus end, so towards the periphery, this is called anterograde transport. So antero usually refers to going forward. And this transport is done by the motor protein kinesin. And then on the other hand, when the vesicles are going in the opposite direction, this is retrograde, meaning backward transport. And this is done by the motor protein dynein. And a helpful tip is that to remember the phrase, they're coming inside to dine in, meaning that the direction of this transport by dynein or dynein is towards the inside or center of the cell, aka retrograde. And so by elimination, you'll know that kinesin does the opposite transport. So this process is especially important for cells like neurons, which are specialized cells of the nervous system. They regulate bodily functions by secreting neurotransmitters. And these neurotransmitters are proteins, and they're actually made right here in the cell body, but they need to be transported all the way down the axon so that they can be released right here in the axon terminal from the cell to act on other cells or on muscles. And so since this is transporting it away from the cell center to the periphery, this is anterograde transport, and so this is mediated by kinesin. And the reverse is also important in these cells because the byproducts over here from the terminal axon have to return to the cell body so that they can be recycled or disposed. So this backward or retrograde transport is mediated by dynein. Now I'm highlighting all of this because this is actually associated with some clinical correlates that are very important as you're studying. So number one is that some pathogens, for example, rabies, polio, herpes simplex virus, and tetanus are called neuropathic pathogens. They cause neuropathic infections because they like to infect the nervous system. So once these bugs actually enter the body, for example, through the skin, they can get into peripheral nerves through the axon terminal, and that's not really that big of a deal. But the problem happens because once they get in there, they can actually use dynein to hitch a ride and basically do retrograde transport all the way back to the cell body where they can escape and gain access to the central nervous system. And there they're going to be able to attack the brain and the spinal cord, and they can cause severe disability problems and sometimes even death. So the problem here is that they can actually gain access retrograde or backwards through dynein, and this is very important. Now, number two, in the case of HSV, which is herpes, after that initial infection, this virus is actually just going to hang out dormantly in the central nervous system, but it can reactivate at any time by traveling now in the opposite direction, so traveling back anterograde to the periphery, so going this way using kinesin, because that's the motor protein for the anterograde transport, and it's going to cause symptoms like painful blisters, which are typical of reactivation of HSV. So important point here regarding this infection is that the initial infections of these neuropathic bugs is mediated by retrograde transport via dynein, and then HSV reactivation is mediated by anterograde transport via kinesin. And then the final important clinical correlates is regarding those chemotherapy drugs that we talked about, so Taxol and vincristine. Remember that the way that they work is by disrupting microtubules. Well, because microtubules are so important in normal functions of neurons, one of the major side effects of these chemotherapy drugs is going to be neuropathy, and that's because they cause microtubule damage in neurons. All right, so now let's talk about the final important function of the microtubules, which are their role in forming specialized appendages. And there's two of these appendages, cilia and flagella. So let's start talking about cilia first. So there's actually two types of cilia, which are these hair-like projections that come off the cells. There's the non-motile cilia, which I've talked about down here. So these are also composed of microtubules, but they don't have any role in motility. They don't actually move. So these are primarily sensory structures. But the ones that are a little bit more interesting are these motile cilia, and so those are the ones that we're going to talk about. So you find these in a couple of prominent locations. One is in the respiratory tract, such as the sinuses and the bronchi. And here these cilia are going to beat, and it's going to cause the mucus to move and clear foreign particles and debris and pathogens from the airway. The second place that you're going to see cilia a lot are the fallopian tubes. So here, this beating of the cilia is going to cause that fertilized egg, which is the zygote, to move along towards the uterus where it can eventually implant. So that's the cilia. Now let's talk about the flagella. These are pretty much just found in one place, which is the tail of the sperm, and their job here is to propel the sperm forward. Okay, so now let's zoom into our cilia and our flagella here, and once we do that, we can actually identify some important structures and some important features. So the first thing is what's called an axoneme, and this is basically just the organization of microtubules. So when we look inside of here, what we're going to see is that these structures are actually just made up of a whole arrangement of microtubules that are all bunched up together, and each of these arrangements is called an axoneme, and this axoneme is basically just a bundle of microtubules that's organized in this 9+2 arrangement. So that means that there are 9 pairs of microtubules in the periphery, as shown right here, and then there are 2 microtubules that are in the middle that are single, so they're unpaired. So the 9 is the pairs out here, and the 2 is the single microtubules at the center. So this is the microtubule arrangement, and that's what the axoneme is. The second important feature is that the motor protein dynein is going to be important here because this is the motor protein that's going to help cause this motility of the cilia and flagella. So kinesin has no role here. The motor protein in these specialized appendages is dynein, and this dynein is actually very different than the cytoplasmic dynein that we talked about in the last slide that was important for cargo transport. The role here is completely different. This is a different dynein. This is known as the axonemal dynein. It is also known as the dynein arm. And the way that this works is that this dynein arm is going to link the microtubule pairs in the periphery with each other. So if we zoom in to these microtubule pairs in the periphery, we can see that they're linked up by these dynein arms, and they're essentially going to link these to each other, and the dynein arms are going to have motor activity using ATP, so they're going to make these microtubule pairs slide up against each other. This is going to lead to the motility of cilia and flagella, so the movement of these dynein arms against these peripheral microtubule pairs is what's going to lead to the beating and movement of the cilia and the flagella. All right, and so here's why this is clinically important, because this microtubule special appendage has a very high yield clinical tie-in. This is known as primary ciliary dyskinesia. So dyskinesia means abnormal movement. So of course the problem here in this disease is that the cilia can't move normally. And the main example of the disease in this category is known as Kartagener Syndrome. This is an autosomal recessive problem where the defect is in the axonemal dynein arm. So that motor protein in the peripheral microtubules that was connecting them, that axonemal dynein, this is defective due to an autosomal recessive condition. So important to know here that in this disease, in these conditions, the microtubules themselves are inherently fine. So there's no problem with microtubules anywhere else. It's this axonemal dynein specifically that's defective. So the only problem is going to be in the motility of the cilia and of course the flagella as well, because they also use this. Now, classically, this disease is going to present with a triad, especially on your exam questions. And this triad is chronic sinusitis, bronchiectasis, and something known as situs inversus. So 1 and 2 here are very easy to explain, right? Because we have cilia in the respiratory tract. Therefore, if you can't clear mucus in the sinuses, you can get inflammation and sinusitis. If you can't clear mucus in the bronchi, you're going to get bronchial inflammation and bronchiectasis. So now let's talk about number 3, which is what the heck is situs inversus. So this is literally exactly what it sounds like. The sides are reversed, so the right and left side of the body, especially in the chest and the abdomen, are inversed. So for example, the liver, which normally would be on the right side, is on the left side. The spleen, which is normally in the left abdomen, will be in the right abdomen. And this is also going to manifest in the chest. So you can see that you have a condition called dextrocardia, where the heart border ends up on the right side of the chest instead of where it normally should appear, which is on the left side of the chest. Now, this situs inversus occurs in about 50% of the patients in Kartagener syndrome. And you may be wondering, what does this have to do? Why does this happen? What does this have to do with cilia? Well, as it turns out, a very important process in embryogenesis is this process known as ciliary rotation. So there's normal cilia function that's required for the organs to be able to rotate and end up in the correct position. So without this process, what happens is that these organs don't rotate and they end up in the quote unquote incorrect position. Interestingly, it actually has no clinical bearing having situs inversus. So the liver works just fine on the left side, spleen works just fine on the right side, the heart works just fine over here. So the situs inversus itself doesn't seem to have any clinical problems. The main issues come from all of these other issues associated with ciliary dysmotility. In addition to this classic triad, the patients with primary ciliary dyskinesia are also at increased risk of ectopic pregnancy as well as infertility because of the role of the cilia and the flagella in the fallopian tubes as well as the sperm. All right, so now we can finish up with the slide. For those of you who like summary tables, here's one that compares the three cytoskeleton filaments in terms of all their key features. So I'm just going to quickly go through some of the important things we talked about with the microtubules. So they're the largest in size. Their building blocks are tubulin, alpha and beta, that form dimers and polymerize. They have two types of motor proteins, kinesin and dynein. Remember that dynein not only does retrograde transport, but it's also important for axoneme motility in cilia and flagella. They have an important role in mitosis, which is in the early part of mitosis, formation of the mitotic spindle. They're also important for forming the specialized appendages, which are flagella and cilia, where the microtubules are important for their movement. The other important function is for cell cargo transport, so anterograde and retrograde, as we talked about up here. And then finally, they have a couple of important clinical correlates, so neuropathic infections like rabies, Kartagener Syndrome, which is a type of dynein arm defect, and chemotherapy drugs, which are microtubule inhibitors. Okay, that is it, and that is all. If you want to learn more about this topic, you can check out other videos that I've linked here. And if you guys enjoyed this video, please don't forget to like, comment, and share it with others. Also, please consider subscribing to this channel so you don't miss out on upcoming content. But for now, thank you for watching, and I'll see you next time.